Well, good morning, everyone. Hope everybody's having a great Thursday. I want to welcome all of our guests to our first ever virtual conference on the business of incarceration. Hopefully you've had some time to join us over the past week, this morning's session, as well as we hope you'll join us for next week's final series as well. Just a quick introduction. My name is Justin Rodriguez. I have the privilege of serving Bexar County as County Commissioner for Precinct 2, which is the northwest quadrant of the city and county. I'm also have had a very privileged opportunity to serve our community as both a city councilman in San Antonio, as well as most recently a state legislature. So finally, though, I can't not mention that I'm also a director with the Texas Lyceum, class of 2020. Shout out to you guys. We see you. Thanks, everybody, for joining us. And just a couple of housekeeping items before we get started in this panel this morning. First of all, we'd like to express our thanks to our sponsors for their continuous support. We know that we can't do these very, very informative panels without our sponsors, particularly in this trying time during this public health crisis. The Texas Lyceum prides itself on bringing together the best and brightest to have really, really in-depth, difficult sometimes conversations about the pertinent topics of our time, and not just pressing issues in our state, but our nation. And we couldn't do this without your attendance and your support. So thank you again to our sponsors. Before we jump into this panel, a couple other things I want to mention. If you have questions for any of the panelists, normally I know there is a chat little box at the bottom of your screen. Do not put your question in there. There's also a Q&A box. So please, if you have questions, go over to the Q&A icon, click that, and you can put your questions in there. We're hoping to have this discussion pretty informally for about 40-45 minutes and reserve 15 minutes or so for your questions. So, so let's jump right in. We've got a great panel of esteemed members of our community from Texas. Of course, the industry of prisons in Texas is not, as you often see in the headlines. Private industry within the prison system goes beyond brick and mortar. Instead, companies contract with state, county, and local municipalities and counties for a variety of services such as healthcare, food, transportation, financial services, phone calls, you name it, education, just to name a few. During this panel entitled Private Industry in Texas Prisons, we're going to take a little deeper dive with some of the leading companies, organizations, and governmental entities that provide essential services for our inmates, as well as the entities that they contract with. So I'm very, very honored to, I know their bios are in your information. You can read more about them, but we're very privileged today to be joined by a few folks here, and I'll just mention them. My good friend, longtime public servant, Harris County Sheriff Ed Gonzalez. We also have with us Mr. Ron Steffa, who's the CFO for Texas Department of Criminal Justice. And then we have Will Rodriguez, who is the Executive Director of Texas Tech University Health Science Center Correctional Managed Care. Michael Bell, who is Vice President of Management and Training Corporation. And Jason Fritchie, who is Business Development Manager for Johnson Controls. So we're going to jump right in. The panelists, thank you so much for joining us today. We know you're very busy. There's a lot going on these days, and in particular in your industry. So let's get to some of the discussion topics that we wanted to cover today. First, let me start with the sheriff and Mr. Steffa. We know that your facilities are run by TDCJ and Harris County, respectively. Wondered if you could tell us a little bit about your budget, how much is dedicated, in other words, from the county, in your case, sheriff, from the state, in your case, Mr. Steffa, to correctional facilities, including staffing costs. Why don't you start off, Mr. Steffa?
Oh, sure. Thank you. And it's a pleasure to be here. Uh, for TDCJ, we actually are responsible for the incarceration of the adult population in the state of Texas. We incarcerate population is just over 120,000 offenders. We also supervise approximately 84,000 individuals on parole, as well as providing funding and support to the local community supervision and corrections department, adult probation, and they supervise about 140,000 probationers as well. So the agency's total budget is $3.4 billion annually. Of that, approximately 80% is for the incarceration component, with the other 20% being for treatment, parole, and probation.
Okay,
And that
great.
includes the staffing costs.
Yeah, and before we get too into the budget, let me back up a second here and make sure we have an opportunity for each of you. And that was a good background, Mr. Steppa. But let me also have each of you just tell a quick, as you did, a quick intro as in terms of what you do. So, Sheriff, why don't you start off and just a few minutes tell us about yourself and what you do there at Harris County.
Yes, well, hello to everyone. Greetings. Thank you, Texas Lyceum, for always convening so many wonderful conversations. To my esteemed panelists, to you, Commissioner, and to everyone that's tuning in, as well as the sponsors that make this possible. I am the elected sheriff of Harris County. Our biggest municipal area or city is Houston. I operate the largest county jail in the state of Texas, and one of the largest in the country. I took office on January of 2017. Prior to that, I served 3 full terms as a Houston City Councilman and Mayor Pro Tem for the city of Houston, where I helped oversee a $5 billion budget, and also again served as Mayor Pro Tem, and also was a district council member. Prior to that, my professional career began as a Houston police officer, where I worked my way up the ranks and worked as a homicide detective, a hostage negotiator, and other key assignments within the police department. So I've been a lifelong public servant, and it's my honor to serve the residents of Harris County. As a sheriff, I not only run law enforcement operations, but I also oversee the county jail system. They're a bit bifurcated, and sometimes it's a bit of different hats that I wear. On one hand, obviously, we want to maintain law and order and make sure that we're being proactive in protecting our community. On the other side, we see the real challenges of operating a county jail system as large as ours. We operate a city within a city, preparing more than 25,000 meals a day. We operate a 24/7 medical clinic and pharmacy operation as well. So it's a real challenging, complex operation. At the same time, we try to be visionary, meeting people where they're at and dealing with issues such as mental illness and addiction. Many all intersect within a county jail system. We have very interesting operation.
Yeah, to say the least, we'll definitely get into that a little bit, Sheriff. Thank you for your service. Let me jump over to Will Rodriguez. Will is the executive director of Texas Tech University Health Science Center, Correctional Managed Care. Will, if you want to spend a few minutes just telling us what you do and about yourself.
Thank you, Commissioner, and thank you to everyone on the panel for being here and for those participating. As the Commissioner said, I'm the executive director of what we call the Managed Care Department at Texas Tech Health Sciences Center. We are entering our 31st year of a partnership with TDCJ to provide healthcare services to approximately now 29,000 inmate patients on the western side of the state. We have a partner on the east side, which is our peers and colleagues over at the University of Texas Medical Branch, and we work collaboratively to provide the healthcare to the entire state. In our sector, we cover about 100,000 square miles, anywhere from Dalhart, Texas to El Paso, Texas, Brownwood, Texas. So you all can imagine that triangle gets pretty. It's a big area here in Texas. We have approximately 850 FTEs that we use to deliver these healthcare services. And we do everything from clinics, basic clinics at every one of our facilities, to a regional medical facility here in Lubbock, Texas, which is 128 bed, basically hospital-like environment. We have 550 inpatient psychiatry beds, 2 ORs. We do dialysis, chemotherapy. We have a huge lab in there. So it's a pretty robust, like the sheriff said, 24/7 operation that runs 365 days a year. We're proud to be a partner to TDCJ and see it as part of the service that the Health Sciences Center as an HRI, as a health-related institute, delivers to the state of Texas.
Great, thank you, Will. Let's go over to Michael Bell, who is Vice President of Managed and Training Corporation. Michael, if you want to tell us a little bit about yourself.
Okay, thank you. It's a pleasure to be here today and have the opportunity to present additional with our colleagues here. My name is Michael Bell. I am the Vice President of what we call Region 3 for Management and Training Corporation. We actually manage here in the state of Texas a number of different contracts with the Texas Department of Criminal Justice on their secured private facilities. There's a total of 11 of them. We operate 10 of the 11, with one of them being idled at the moment, namely the Bradshaw State Jail. I actually began my career in 1983 with the Department of Corrections back then as a correctional officer. And then in 1995, I joined Management and Training Corporation. And I actually served on several different facilities as a warden for about 17 years, and then going into my 7th year of being in this position of Vice President. Management Training Corporation has been around since 1981. It actually got into business of working with disadvantaged populations at youth with Job Corps, and working with that population in the Job Corps area of doing training with academics, vocational, job readiness, and helping them transition back. And once they completed their Job Corps, in 1987, Management Training Corporation moved into the criminal justice corrections, actually doing the same thing, of actually going inside prisons and providing these services, as well as operating the whole secured facilities along with the programs. We later expanded into a number of different states across the United States. We're the largest Job Corps operator in the United States. We also are in Australia as well as in the UK, and do probation and parole services there in London and Thames Valley, as well as juvenile facilities. We, with the company, is basically our approach is trying to give individuals the tools that they need to work with as they're getting ready for reintegrating back in their community, whether that's in the Job Corps arena or in the correctional arena. And again, we thank the opportunity of being here today.
Great, thank you very much, Michael. Finally, rounding out our panel today is Jason Fritchie, who is with Business Development at Johnson Controls. Jason, welcome, and you have a few minutes for an introduction as well.
Thank you. Glad to be here, proud to be here. So I do work for Johnson Controls. We're a global organization. As it relates to the state of Texas, we've been serving the state of Texas since 1901. So I wasn't there when it started. It's been around for a while. We have over 3,000 employees in the state. We have 10 branches across the state, and we have a large York chiller manufacturing facility outside of San Antonio that makes chillers for North America. As it relates to corrections, we're one of the leaders working in the correctional industry. We from a safety perspective, we work with cell locks, fire alarm systems, perimeter detection systems. We install, service, and maintain HVAC equipment, energy management systems, and then we do self-funded infrastructure programs for correctional facilities as well.
Okay, great. Well, as you can see, we've got folks representing both the private and public sector on this panel, so it should be a great discussion. Ron, I know we jumped right into the question with respect to your budget. Sheriff, can you also talk a little bit about how much, if you guys are like us at Bexar County, you probably are either going through or just finished the budget for fiscal year. Our starts October 1. Can you talk us a little bit to us about how much of Harris County budget is dedicated to the jail and specifically your operations and staffing, and just a little talk to us a little bit about that.
Yes, our budget, we're the largest section of our Harris County budget. Criminal justice system is, if you include other areas like the public defender's office, DA's office, and all of that. Our budget just overall is over 550 million. Of that, over 217 million goes to salary and benefits on our correction side. If you include other services that we have, other expenses, we're looking at roughly $241 million. That includes salary and other expenses just on our corrections operation. On our medical side, which we also have a separate line item, that is $80 million overall. That includes salaries and benefits for the medical staff that we have, the pharmaceutical staff that we have, and on the pharmacy operation itself, if we were to remove that, we spend over $12 million a year treating those that are in our care for some type of medical need and other areas. So it's a pretty large operation, and so that's when we're looking at the numbers, that's what we're facing. So we're looking at an overall $321 million combined budget for medical and other corrections expenses, including salaries and benefits.
Okay. And before we switch back to Ron, I want to talk a little bit about, I know the jail is kind of a transitionary place for folks. They're not necessarily inmates held there for, in most cases, not an extended length of time. So Sheriff, can you tell us a little bit about the inmates housed at Harris County Jail, how long on average they stay, and what the I guess the average length of time is for someone in the jail?
Yes, Commissioner. Prior to COVID, our average length of stay, typically in a county jail, they are going to stay shorter timeframes than in a state prison system, for example. Prior to COVID, it was 132 days on average. After COVID, that's increased to 214. And we house a very large pretrial population, pretrial detention, meaning that their cases are still moving through the system. And so the pretrial population in and of itself is 228 days. We wish those numbers were a lot shorter. Data is very important to us. I've tried to move the Sheriff's Office in a more data-driven direction. I'm probably one of the only systems that actually has a public dashboard on our homepage of our website, where every day the public can look at a lot of different numbers within our Harris County jail system. And that's important for me as the executive over the system to see what our numbers are looking like, demographics and everything. I know, for example, that today I have over 8,500 people that are incarcerated in our Harris County jail system. I could see the gender breakdown. I know that over 91% of them are male. I know, for example, that 35% are on psychotropic medications. So I could kind of see what my costs are for that. And again, in the county jail system, we're treating a lot of mental illness and a lot of other health ailments. Those that come into the jail system typically are less than healthy. So we spend a lot on medical care. I have a large number, hundreds that are between the ages of 56 and 65. I know that 87 of the individuals that I have are 66 and over. So having that information really helps me to then see what services I may need to contract out. We try to be very forward thinking at the Harris County Jail Office. For example, we're working with Michelle Diedrich at UT, for example, so that we could focus. I saw that we were seeing a trend in corrections where we were housing more females. Well, jail systems and prison systems typically aren't really built with women in mind, or weren't designed, especially older buildings. And so we're looking at programming and other things that we need to contract out to make sure that we make their temporary home while they're here a little bit better to address the needs of women that are in jails. Our current jail population right now has over 700 females that are incarcerated, and that's actually lower than what the average number tends to be.
Great, thank you, Sheriff. Mr. Steffa, can you give us a perspective from your vantage point? We heard from the sheriff about typically how long their average inmate stays in the jail there in Harris County. Can you give us a perspective, I guess, more statewide as it relates to TDCJ and the average stay in one of your facilities?
Oh, absolutely. Our population is diverse. Our ages range from 17 all the way to 91 years old. The average age is 40. Our population is similar to that of Harris County, where 93% is male and about 7% is female. Our population is also about 33% Black, 33% white, and 33% Hispanic. The average sentence length of an on-hand offender is 20 years. For those offenders that were released in our fiscal year 19, that average sentence length was just about 7.5 years, and they served on average 60% of that sentence upon release.
Great, thank you, Ron. So before we switch over and talk a little bit more, maybe this is a good transition on the private sector side. I wondered, Sheriff, if you could talk a little bit about how much of the services you provide you contract out to private entities, how much you do internally, if you can just give us a snapshot on that.
Yeah, we contract out quite a bit. Again, we're a city within a city, as I mentioned earlier. So it runs the gamut, the spectrum. Obviously, we're contracting out for like supplies now in the COVID era, like PPE materials. Typically, we purchase furniture, all our different intercom systems, video camera systems, a lot of the IT software we're buying. Also, we heard Johnson Controls earlier. We've worked with them on different system upgrades and maintenance. A lot of our maintenance, because we're talking about large mechanical systems, kitchen equipment, all of those things we contract out. We do have a vendor that oversees our kitchen operation as well as the maintenance overall of the county jail system. There's always things breaking down. And again, we're a 24/7 operation, and we can't afford to have toilets not working or water systems backed up. And so we work with the private sector on that as well to contract different things, as well as just different supplies and the overall, getting, commissary is also contracted out to a private vendor as well. So a large piece of our population, of our day-to-day operation is contracted out to the private sector. And that is through just the regular bid and procurement process. And we do have a county purchaser that's assigned to the county jail system, but then the Harris County purchasing agent, their primary office, they oversee a lot of the procurement process. But phone systems, video conferencing, all of those are farmed out.
Okay. Thank you, Sheriff. Yeah, same in Bexar County as well.
Yes.
Ron, same question for you. You've got a larger organization statewide at TDCJ. Tell us a little bit about, I guess, maybe the number of employees you've got, and I would assume you do a lot of private sector business as well, just out of need. So if you could talk a little bit about that.
Absolutely. Yes, we have over 34,000 employees. We cover the state from all the four corners of Texas. We do a number of operations in-house, but we also contract for a good number of goods and services. We'll contract for everything from security equipment, plumbing and electrical parts, supplies, and food for offenders. We actually operate our own food service with our own staff, but we contract then for all of the food that we bring in. And also we have a agricultural operation then that supplements our food service department with fresh vegetables. And as far as the services, we contract for a variety of those as well. We have treatment services for the offender population, substance abuse services, treatment services, as well as our privately operated facilities. Of our privately operated facilities, we actually own the buildings on all but one of those facilities, but we contract for the operation of what is now 10 privately operated facilities. I had to change my numbers a little bit because we just recently closed 2 facilities. And then, as Mr. Bell mentioned, we idled a state jail as well recently due to offender population trends. In addition to the private facilities, we have contracts for construction related services for our major repair projects, such as when we're replacing a roof. We also contract for architect and engineering services associated with those contracts. And then Mr. Rodriguez represents one of our contracted partners with Texas Tech University Health Science Center and UTMB in contracting for the medical care that are delivered to our offender population.
Yeah, that's a great segue, Ron, to talk a little bit about some of those services that are outsourced. And in particular, right now with the public health crisis, I want to shift over to Mr. Rodriguez a little bit, since this is your specialty, and wanted to see if you could talk a little bit about the challenges that you and your organization, your group has faced with COVID-19, addressing some of those issues with TDCJ and others to try and combat this global pandemic.
Yes, like everyone else, PPE was a big deal. There was a shortage. We partnered with both TDCJ and with our engineering department. Some of the things we did is, like Mr. Steffa said, we have an industry inside of the Texas Department of Criminal Justice, and they busied themselves on creating face masks and face shields for our teams and themselves. And we partnered with our engineering school at the Texas Tech academic campus for the same. The other items that came up in our world were space. In a prison environment, space is, we don't have a whole bunch of it. It's not intended to be a robust building space for each individual. So we had to work closely with our TDCJ security partners to ensure that we were controlling movement in the appropriate manner so that our patient population could continue to be seen. We were very proactive. I tip my hat to TDCJ in securing and implementing testing processes proactively so that we could find asymptomatic folks who were asymptomatic with COVID. And then when we identified those patients, we isolated them in what we called medical restriction or isolation areas, cohorting those folks so we could keep the population that was not affected by the virus separate, therefore controlling the spread of the virus on the units. And I can, overall, I think we've done a really good job in the space that we've had managing the COVID population on the in the prison units. We also had to partner. I know TDCJ partnered with our jail partners like Sheriff Gonzalez on how we intake folks, and then when we do start intaking them, how do we quarantine them? Because it's not just how do you quarantine them? How do we quarantine them when we get them here? Because we have certain, and which units do we put them at? So it took a lot of collaboration by a lot of parties, but I think overall we've done a good job at maintaining it inside the system.
Yeah, and you touched on something that I think is important. We talk about healthcare often. We forget about mental health, and in particular, I know in many large counties like Bexar and Harris, the single biggest provider of healthcare services is oftentimes the jail, which is a sad fact but true. Sheriff, let me kind of pivot back to you, because I know for a long time you've been a champion for more progressive mental health policies. We implemented and are starting to implement some changes here in Bexar County. I'm sure you are too. I wondered if you could talk just briefly about how your office addresses not just mental health in the facility, but your officers out on the streets in terms of de-escalation and trying to address, what really is a community issue, and it, I guess, overlaps with public safety as well. So if you could talk a little bit about anything you're working on there with respect to mental health.
Well, thank you. As a police executive and a jail administrator, I've really tried to keep a forward-thinking perspective in terms of approaching public policy. You know, my experience has taught me that law enforcement in the modern era is grappling and in the front lines of three important issues, and that's mental illness, addiction, and poverty. And simply incarcerating isn't going to help us really address those issues. We can have a role, but we don't necessarily need to be on the front lines of that. And so we've tried to really see how we can leverage technology and other, again, public policy to really be innovative in our approach. So a couple things that we've done. One is we're meeting people where they're at. As I mentioned, we have a lot of people that come through the jail system that we know have addiction. So we now have a very robust medically assisted treatment program where we're providing some of that medical intervention, that drug care intervention inside the jail system, as well as couple it with some support services as well. So when they come out, they have that support. And hopefully, and we're seeing good numbers in terms of lowering the recidivism rate. We're also, we implemented our core program, which provides some of our frontline deputies with an iPad, and they can connect with a mental health technician around the clock whenever they go to a crisis call, so they can connect the mental health professional to the client that we're responding to, and kind of we just become the middleman, but we're not the front one trying to be a mental health worker ourselves. So that's been very helpful. We also have the CERT program that matches a mental health clinician with a deputy that responds to some of the calls. We've increased our crisis intervention training to a lot of our staff. Those numbers were in the single digits when I took over. Now we've grown that training to every member of the agency. We went to 40 hours training before it became a mandate. We're also now implementing ICAT. It's a de-escalation training program that's offered by PERF. They're kind of a national think tank on policing that we're excited about as well, that I think is going to really have benefit. We also are trying to become proactive. We launched Project Guardian just last week, which really helps our deputy become better informed on autism, for example, and community members that apply for the program get a decal that they could place at their home. So when we respond to a home, we know that someone in the house is grappling with autism, and we could then, it prepares us with more information. We're also launching more training for our dispatchers as well, because we know that that initial information is very critical. We're also collecting better data so we could really have a holistic approach in terms of the number of people the calls that we respond every year where there's a mental health crisis involved. And we're doing a lot of other things that we're very excited about to try to be proactive in our approach to de-escalation. And again, how can we best deal with a population that's coming into our jail system? We have a veterans tank as well. We're bringing direct services to our veteran population as well that are grappling with addiction, PTSD, and other things. So I'm very proud of those initiatives. You know, prior to my time on here as a sheriff, when I was on city council, we went to Haven of Hope and to San Antonio. They've been some of the most innovative leaders. I think you were involved in helping connect us before with some of that, and learning about the Sobering Center there. We borrowed that model. I'm not ever afraid to borrow a good idea to make sure that we brought it here. As city councilman, I brought a Sobering Center that's still established and doing extremely well. We also, during city council, we know that sometimes we got to deal with our juvenile population. So we launched Cafe College Houston, that was modeled after what your council did with then Mayor Castro. You know, we launched something here. Back to the inmate population, I did some research, and I learned that every year we have 90,000 children that have a parent that's incarcerated in our jail. We know, and I'm sure my colleagues know that on this panel, that if a child has a parent that's incarcerated, it's a good predictor that they'll probably become justice involved. And so we're trying to intervene early, provide wraparound services with no additional funding. These are already services that are provided in the community. We're just simply connecting them, and we're seeing success with that. So we can make sure that those children don't feel the impacts of incarceration on their family.
Yeah, great work, Sheriff. I know there's never a dull moment in what you're doing, and we appreciate your work on that. Let me switch over quickly to Mr. Bell, because I know you know, we haven't had a chance to visit with you yet this morning. I know you've had, as you mentioned in your opening remarks, some varied experience with respect to facilities, being a warden previously, and a long career with TDCJ. I know we often try to figure out, how do we, folks that have to come through the system, right? No one wants to be in the system, but folks that have to come through the system, how do we get them back on their feet, get them back out into a productive role in society, for their families, for the community. So Mr. Bell, I wondered if you could talk a little bit about what ways you've seen education impact inmates, and just talk a little bit about maybe some programs and apprenticeships that you've been involved with, that you've seen some success from.
Well, again, very encouraged about what I've seen and what I've working with in our career is, you take an individual that goes through and completes their GED and or high school diploma, to see the sense of accomplishment and pride on that individual's face, or his family, or their children. It's just huge, and it's something that might be the only time that they've ever successfully completed something. And so we work with, providing these services. We also partner with Goodwill, Central Texas, out of Austin, in their Excel Charter School. We have them on several of our facilities. We're providing high school diplomas with them. And not only, at our facilities, we have the opportunity to do the GED and getting them prepared to pass the GED, but additionally, we have the opportunity of doing the high school diploma. And for an individual to have a chance to get awarded a high school diploma, I think that their earning over their lifetime can actually be greater than maybe than the GED. Both of them are still good. Both of them are still accomplishments. But also it kind of works into being able to potentially do dual credit with community colleges. We actually work with a number of partners. Kilgore College out of Kilgore, Texas is one of them. Hill County College up in the Dallas-Fort Worth area. Travis Austin Community College there, University of Texas. And really where these individuals that might be accomplishing a task while they're there, but actually get similar to what happens in the high school, where they can get dual credit. And so doing these courses, and whether they're electrical or welding or vocational, it's just a sense of pride. Recently, over the last 2 years, we piloted a program with probationers, individuals that are been in, they're only usually there for a 90-day period. They're there for a cognitive program. They might not, because of their short stay, not be enrolled in the GED program, but we've actually done a peer-led group at this particular facility up in East Texas. And individuals there, what they're in their housing area, will give them the materials that they need to work with. Over the last 2 years, we graduated over 600 individuals through peer-led in their housing area, and then able to test them with their GED and get them their GED. But many of them, again, the pride that they take with their family and their kids, and showing their kids that, hey, you can still do this. You don't have to give up. Other programs we do, working with empowering women at the Lockhart facility, that actually entrepreneurship, prison entrepreneurship there out of Houston as well, that working with them and actually giving individuals entrepreneurship and leadership skills to help these individuals when they get out, where they can actually start their own business. So there's a variety of things that being innovative and finding new ways providing these services, and we wouldn't be successful if it wasn't for the agency, is because of the individuals that we're housing, or most of them are getting ready to go home. They're probably 3 years out, but our success would not be without the support of TDCJ. And it's, again, a collaborative effort of community, nonprofits, the state, private sector, all working together to make a difference in these individuals' lives.
Great. Thank you, Michael. Want to remind folks, we still have some more discussion here, but want to remind folks that are viewing, if you have questions for any of our panelists, there's a Q&A icon at the bottom. Please submit them there. But Michael talked a little bit about kind of I guess the human element, and we've all heard about the human element of the prison system and jails in our community. There's also a facility element, right? We want to make sure these facilities are safe, that they're efficient. So I want to bring Mr. Fritchie in here for a minute and talk a little bit about what Johnson Controls has done over the years with respect to facilities. And maybe Jason talk a little bit too about maybe how your role has maybe evolved or changed now that we're in this COVID-19 environment.
Sure. I think Sheriff Gonzalez said it best when he said these are small cities, especially when you get to the state facilities. They've got their small cities, but they have big city problems. They produce their own water, they treat their own sewer, in some instances they make their own food. They've got manufacturing there that's textile plants, furniture plants, things like large refrigeration distribution centers. I mean, there's a lot going on at these facilities, and there's a lot of needs there. COVID has really changed everything. When you have people in the confined areas that they are and not always able to social distance anything from COVID, even, the flu, everything spreads quickly. So, we've got, from a working in the facilities, we've got our own checks that fit with the checking procedures that our correctional partners have, daily check-ins. And then, we've got the UVC lights that we've installed that go into the air handlers that cleanse the air as it goes into the space. And then thermal cameras that you can pan out from a wide area. So you panned out in the yard and it'll tell you the temperature of the people that are in the yard. So you can find someone that may not have, know they have a fever or want to report they have a fever. You can see it. It's right there on the screen, and you can isolate them if they're symptomatic or asymptomatic. But from an infrastructure scenario, people aren't building new prisons. The shift is now to prison reform, and we want to get more training to help break this cycle. And so we've got older facilities. No one wants to fund upgrades. Capital outlay is tough to get. And so we've got a program that we've been successful with where we go and make self-funded infrastructure projects, where we come in and identify the improvements that can be made, and it's funded out of the existing operating budget. So we look at what utilities you're spending, electricity, gas, water, what you're spending on contracted services on repairs, and we quantify that dollar and we sequester it, and that's the funding source for the whole project. And then Johnson Controls guarantees that savings. So if you have a 15-year contract, and we guarantee that you're going to save $2.2 million a year at the end of year one. If our customer saved $2 million, we write a check for $200,000 and move on to year two. If they save $2.4 million, that extra $200,000 goes back into the general fund. So for the Louisiana Department of Corrections, we did a statewide project with them. We were able to do $29 million worth of improvements, and this was all funded out of their existing operating budget. There was no money appropriated for capital outlay from the legislature. There was no new taxes. And then the other benefit was it created 560 direct jobs. People went to work because of this project that was just completely and totally self-funded and trying to do things more creative and differently. And probably the thing that I'm most proud of that came out of that is we developed a reentry lab. So we were able to fund a lab at Angola in Louisiana. We also have one in Virginia, where we teach the offenders. They've got 3 different levels of HVA certification, but they learn how to work on HVAC equipment. They learn how to work on energy management control systems. And when they get out, they have a career that they can, move forward with. And behind me here, this is our lab in Virginia, and it's full of today's state-of-the-art equipment that they learn to work on. In the 10 years that both of these labs have been open, we've had 120 graduates, and only five have come back, and they've been for minor violations like parole violations. Pretty excited. We got a letter the other day from one of a gentleman that graduated our program. He went back after he got out, he went back to Old Dominion and got a degree in mechanical engineering. So, I mean, this program is changing lives and making a difference. Our first graduate out of Angola, he reported back that his first year You know, this is with overtime, being an HVAC technician. He was going to make almost 6 figures that 1 year. So he went from incarceration to a career path. He's not coming back.
Yeah, that's a great success story, and that's what it's all about, right? Is trying to help people turn their lives around. Just a quick follow-up, Jason, on the facilities that Johnson Controls is involved with in Texas. How many would you say are correctional facilities in the state? And maybe you can, I don't know if you have a snapshot of around the country, just an idea of how many that you contract with.
It's so contracting, that would be I don't know that I could tell you that number, because there's so many that, from, you know, when you're talking about cell block locks to fire alarm inspections to chiller services and things like that, it's a lot. For, you know, the self-funded infrastructure projects, state correctional facilities, probably about 20, 25 across the nation. And then some local, we're working in the Lubbock County, installing at the Lubbock County Jail right now, some energy efficiency improvements there as well.
Great. Thank you again for that insight. I want to shift a little bit back to COVID. Obviously, this is the whole reason that we're doing this virtually is because of the pandemic. And want to switch back over to Mr. Rodriguez and Mr. Steffa. Really with respect to the challenges specifically with our aging population. I understand that we're going to have this conference in person. We were going to be on the campus of the Stiles unit in Beaumont, Texas, which I understand is specifically a congregate setting for our aging population of inmates. So let's start with Mr. Steffa. Can you talk a little bit about I guess the if you're familiar with that unit, obviously, and these challenges associated with treating patients in particular that are in that vulnerable age group.
Sure, and while the Stiles unit as a whole isn't a geriatric or an older type facility, it does have what we refer to as a sheltered housing unit. It's one of 6 units that we have statewide that, for the older populations, when they have physical or cognitive limitations and they're not able to keep up with the normal pace of a prison schedule, we're able to put them in this sheltered housing environment that gives them a little bit more time to do their daily activities, as well as separating them, because of those limitations, they're often a more vulnerable population, as well as concentrating the medical resources then that they're needed for that population in a very efficient and effective manner, because they are together. We also have one full facility, the Duncan Facility in Diboll is our geriatric facility. It's a 600-bed facility that houses the older offender population as well. And so during COVID, the older populations that have comorbidities are much more of a vulnerable population. So as the agency's undertaken our mass testing, we've prioritized that population. We have full PPE and protocols for everyone in our facility, offenders and staff. But that population is one that we're especially looking out for and doing everything we can in targeting the testing then to identify any asymptomatic offenders, and then take the appropriate, putting them either in quarantine or separating them from the population to reduce the spread. So it's a population that we work closely with the medical providers and our correctional managed healthcare in getting the best guidance and the most up-to-date direction we can from the CDC, as well as our experts both with UTMB and Texas Tech. And so if Mr. Rodriguez would like to add to that, they play a large role in both providing the medical care as well as our response to COVID for that population.
Yeah, well, can you add some context to that as well with your role there at Texas Tech?
Sure. So by combining groups, like Mr. Steffa said in the question you asked, Commissioner, what you can do is create, if you will, centers of excellence, and you can allocate resources where they're needed. and then you can partner with your community resources to support the needs, because obviously we can't provide everything within the prison system. And we typically look at the triple aim when we're looking at healthcare inside prison or correctional systems. You know, the first thing is access to care. How do we get the patients, as we refer to them as patients, because once they present to us, we're healthcare providers. So they present to us as patients, not offenders. That's something different. So once a patient presents to us, we have to make sure we have access to care. Then we look at safety. And then that's where we employ tools like telemedicine and leverage our one of the things that we did in the last year is we started using Tele Optometry. Historically, we would have to, from time to time, take these patients to go see optometrists in the free world. Well, we partner with an ophthalmologist, found the right technology, and now we bring an optometry tech with a mobile cart to our prisons, and they provide the eye exam there on site. So now there's safety. You know, we got them access, there's safety. The interesting thing that I learned that I didn't know and never thought of, I've been in the system now for about 4 years, is that the patients that don't want to leave their unit because they can get reassigned. That's just the way it has to happen inside a prison system. So the more you can keep them at home, if you will, the better off they are. Everybody wins that game. And then lastly, that addresses cost, because of course, if we're not transporting people, and when we're talking about these older populations, which kind of equate to, if you look at the Medicaid population, in my previous life, I spent 9 years working for managed care for Texas Medicaid. It would equate closely to the age, blind, and disabled population, to where it makes up a small portion of the overall population. It does attribute for a large part of the spend of the overall cost for those programs. So what we can do by employing things like centers of excellence, telehealth, between ourselves and UTMB doing the larger amount because their system is so much bigger. They do 80% of the population, we do 20. We have the second largest telemedicine footprint in the US, second to the federal government. So we do just over 150,000 telehealth visits combined for TDCJ on an annual basis. And this is how we leverage our resources. We partner with each other. If UTMB has a 340B pharmacy resource available to it, we have some psychiatry resources. You've mentioned mental health many a time. And as this patient population ages, the mental health of the patient population is very important. So what we look at is, do we need to transfer, or can we support one another via telehealth so that our systems can take care of the patient, and we don't worry so much about who does it, but what is the best thing for the patient outcome?
Great. Yeah, thank you, Will. I want to shift back to the sheriff for a minute. One of the things, Sheriff, that I've just been, a little bit surprised about in a good way is, when you have jails and you have these congregate settings, particularly as it relates to COVID, that at least in Bexar County, there's not been, knock on wood, significant outbreaks amongst inmates or the deputies that patrol the jail. I wondered if you could talk a little bit about the challenges with respect to COVID and keeping both inmates and your employees safe. Have you had any particular outbreaks, and how have you dealt with that?
Well, I think the success that we've seen, and I'm sure Sheriff Salazar in Bexar County would agree, it's really a testament to our frontline personnel. Again, we have a medical unit. We did have an outbreak in the beginning. I sounded the alarm early on here in Harris County that, again, like you said, with the congregate settings, with the inability for any jail or prison system to truly create social distance and all of that, especially in the beginning, it was a little bit hard and challenging to get equipment and things like that, and really trying to understand CDC protocols. We were trying to build a plane as we flew, and but we were aggressive. Our medical team was aggressive. The protocols that we put in place have truly helped. Right now, we're in a little bit of a downturn. We expect a possible uptick maybe in October that we're preparing for, because with flu season, and it's going to be really challenging with COVID and flu and all those things. So we have an infectious disease response team that we're working on, that we have here, where we have a medical doctor that I task solely with trying to make sure that we're following best practices, that we're doing mass testing as well. We thought early on that it was the best thing to do to make sure that we were testing our population as well as our personnel. So we've been able to test more than 95% of the people, our defendants, as well as our personnel that manage the jail. You know, all my colleagues, I'm sure, would agree. We have a challenge of jail churn. Again, we have large populations. I mentioned my current population here in my complex is over 8,500, with over 2,000 employees that come in and out of the system, both contract workers as well as our staff. There's jail churn. People are still breaking the law. We're still making arrests. They're coming into the system daily. We're able to nip it at the bud up front with some mass testing, but nonetheless, it's hard to catch everyone. So all those are real challenges. And we also wanted to notify and inform our community here that jail health is community health. And, you know, our staff members go back into the community. They're also coming back into the system, sometimes being the carriers and bringing it into the system. It's hard to really provide a lot of care from a distance because we have to get close to people to provide meals and other things like that. And back to the community health is we wanted to inform our community that if we didn't manage the population here and try to manage an outbreak, that we would see it spilling over into our public health system. You know, because as individuals get sick, we're only able to provide limited care within a jail setting. Those that become more seriously ill, that have other underlying disease, could ultimately fall into the community health system, and that was going to overburden the health system. And we wanted to make sure that those beds were left for the community out in the free world. And so it takes a lot of education to inform the community, as well as making sure that we're reminding folks about not only wearing a mask, but not wearing it under their nose. We're doing fit testing as well, because one size doesn't fit all. Especially in these hot zones, they've got to be fitted. So we're doing some of that. So again, just a lot of heavy lifting every day. We can't take our eye off the prize, which is to make sure we're running a good operation. And I'm sure it's challenging for the state system. And one of the challenges we had is we understand the concerns at the state system when they had to limit the number of intakes going in from county jail systems. Those are challenges as well, but we're all in this together, you know, and we're making sure that we're all working collaboratively with all local, state, and federal partners as well.
Yeah, Ron, any observation on that with your purge on the statewide level? You know, the sheriff had some good insight on how they're dealing with it there, but do you want to add anything to that?
Well, we took a similar approach early on and put protocols in place to screen everyone coming into the facility to try to, you know, minimize the introduction of it. And then we've, you know, as Mr. Rodriguez pointed out, securing some of the PPEs initially was a challenge. So we were able to convert some of our factories into actually factories that produce the PPEs for both our staff and our offender population. And so we were able to produce the masks and as well as gowns. And we're working with the Division of Emergency Management to one, secure, and we have sufficient levels of personal protective equipment. But what was a large game changer for us is when we were able to do mass testing. And so because so many of the population may be asymptomatic, but actually have COVID-19, that testing allowed us to identify early who would have that and then take those precautions to separate them. And even if it may require putting the unit on a medical restriction that limited the movement, then that would reduce the potential for spread. So a lot of those protocols and efforts that we put into place, temperature checking, both offenders when we were releasing them back into the community, that was a priority for us to ensure we weren't, you know, introducing anyone that may carry it there as well. And working with the counties, we did limit intake for a period of time just to try to not let it come into the system. And we've recently opened that back up. And so we're resuming intake in a very diligent and safe manner.
Great. Yeah, Ron, thank you so much. And we are rounding out the hour. So I think we need to wrap up. It's been a great discussion. We could probably go on and on with respect to the business of incarceration, right? And how you're running your respective systems, how your private sector is company impacting services to our inmates. But I just want to thank our panelists this morning for spending the hour with us. It's great to see everybody. I want to thank also all the participants who've listened in. Thanks again for being part of this Texas Lyceum panel. We appreciate it very much. And y'all go and have a great rest of your day and week. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.